It's the family and values. And this morning we're talking about pancreatic cancer. As I said, my teeth almost come out. Okay, doctor is going to be here to be doing justice to that. We have the medical director in charge of Waterfalls Hospital in Okota and also another outlet in Igado. It's so good to have you, Dr. Emmanuel Onyinuche. Good morning, sir. Hello, doctor.
Yeah,
are you there?
Yeah.
See our doctor, ever looking young and looking, medical people. There's no way you see them and you see the signs of health radiating around them. Joy, what's your feel about this?
Doctor is always looking good. I'm coming for your face cap, don't worry. I'm
I remember on one of the girls said, show us your face cap picture.
Yeah.
It goes a long way.
So I'm coming for that. I'm coming for that.
Thank you so much, doctor, for joining us. I know your hands are full, and when we're chatting, say you're consulting. But thank you could join us. Thank you. We appreciate this a great deal. Okay, we're talking about pancreatic cancer. What is pancreatic cancer? What is it? What does it involve? What brought about this particular ailment?
Okay, thank you, Molly and Joy. You guys are also looking lovely, like media. Looking forward to this event. So, pancreatic cancer, just from the name, is a type of cancer that affects the pancreas. The pancreas is what we call an endocrine organ. It's an organ that is just there in the abdomen towards the upper part. That pancreas, the major function is to secrete insulin. You must have heard of insulin. Whenever you talk about diabetes, you can hear insulin. Insulin is that hormone that helps to regulate blood glucose. So the pancreas is a very important organ in the body. It secretes insulin. It also plays a role in digestive system. It has some other enzymes that it secretes. So when the pancreas is affected by cancer or infection, it's often serious. So pancreatic cancer, in a nutshell, is the cancer that affects the pancreas. So it attacks the pancreas, and so that's it. It's a deadly cancer because it is often detected late. Although it's not too common, but it's one of the most deadly cancers because of late detection. By the time the patient really begins to manifest the symptoms and signs, it's almost irreversible. So it affects the pancreas, and like I said, it can be deadly because of the location and the time at which it may be detected.
I heard you talking about symptoms, or you wanted to start talking about the symptoms. What are the early warning symptoms that we should watch out for? Since you said it's a cancer that once it's showed up is deadly and is detected late, so what are those early warning signs that we should look out for? Because a lot of people have died not knowing this particular cancer, and when they realize it's late. So what are those warning signs that we could actually look out for?
Okay, thank you, Joy. So I start with your last comment. A lot of people have really died. In fact, the patient about 2 months ago, the patient eventually died also. The problem we have in our community is that majority of the people think that the sickness that people have is just malaria and typhoid. It's amazing the level of medical ignorance and illiteracy. So people can be very sick, they come to you, they'll still be talking that the typhoid is still in their body. The malaria is still that they think, they wouldn't be telling you that they think it's typhoid or malaria. So I had a patient like that who have been taken to all places, and immediately the woman appeared, her eye was deeply yellow. So she was heavily jaundiced, abdominal pain, vomiting, very poor appetite, and of course, they developed diabetes in early age. The children say, our mommy doesn't have sugar problem before. This is just something that was recently discovered. She weighs a lot. Of course, we ran the profile for blood glucose and realized that her blood glucose was high. She was diabetic, you know. So, and then this diabetes that is starting late in her life, someone that is already close to 70 years or more, and weak, yellowness of the eye. So, immediately from our suspicion, so this may be pancreatic cancer. And truly, when we did a CT scan for her and all that, it was discovered that it was pancreatic cancer. But of course, it was already too late. So unfortunately, that woman died. So that's a way of introducing the warning sign. Unfortunately, the early warning sign.
One topic we really
don't
to
want to miss
discuss.
anything out.
Not at all. Not
really,
at all.
I would also want to know, why is it out of ignorance or carelessness that brings about the late detection?
I think it's just the way we take our health, you know, just like doctor was saying, you're sick and you feel like it's malaria, you feel like, oh, I have typhoid, and then you start taking drugs. Meanwhile, there's an underlying sickness. I know of someone who was actually told, you have breast cancer, and she said, no, I can't have breast cancer. And then she went back home, started living her normal life, and then got to a point that, in fact, by the time they now operated and removed this, it was that bad. Now she's living this, so she's praying that now I need healing. And when I met her, I said, when they first told you had breast cancer, she said because she was rebuking it. It doesn't run in her.
Don't forget, this month is actually the breast awareness cancer month, and it goes a long way for us to understand that we need to look out for ourselves.
Very, very important.
We need to look out for ourselves. We need to understand our body. We need to know when it's just like when you are making your rice, and while boiling, the water starts coming out and is messing up your burner. You understand? You will know what to do.
Definitely.
It's either you try to reduce it, know what to do, because you know whether it's the water that is too much, or you need to just put it by the side. Okay, doctor, welcome back. You can continue from where you stop about the what are the symptoms that we need to look out for. You can continue from there. Welcome back. Thank you.
I've already said that but common symptoms that you can notice may be abdominal pain, which radiates to the back. They can feel pain at the back, and that pain is persistent. Again, another common sickness that people have or think is ulcer. So you also see patients who come, they say, I've been having this pain radiating to the back. So you see that a lot of things can cause pain that are not ulcer. So the person might be getting treatment for ulcer and it's not getting well. So if it is persistent and recurrent, we think of pancreatic cancer. Unexplained weight loss. Sometimes you look at it, suddenly somebody that was very plumpy begins to lose weight. People say, you do have HIV. It may not be HIV, it might just be pancreatic cancer. And then one of the things that is the warning sign is jaundice, yellowness of the skin and eyes. In fact, it is said to be yellow warning sign. That is the way we put it. So someone that doesn't have hepatitis, doesn't have problems, suddenly having yellowness of eyes. I mean, one of the things you can think of is pancreatic cancer. And then, like I said before, people who are not diabetic, later in their life, they suddenly develop diabetes. Please, it's important that pancreatic cancer is considered. So those are some of the common symptoms or signs that you can look out for to be able to suspect that this person may have pancreatic cancer. And like I said, when these things start noticing them, sometimes it's already late.
Does our way of life has anything to do with pancreatic cancer, or family history? What does it have? Does it have anything at all? Maybe it's genetic or something like that. Do we have any of these two? Does it have anything to do with pancreatic cancer?
Yeah, exactly. Those are under what we call risk factor. Sometimes you cannot say this is exactly what causes a cancer. So you can really look at the risk factor, and the most common risk factor is smoking. We have always said that there is no advantage in smoking. Maybe some people can even say alcohol, we do this, they have some positive effects, but smoking has no advantage, has no benefit, health-wise and otherwise. So smoking is a major risk factor, and like you said, like other lifestyle, like diet, a lot of all these refined diets, which can tip people to obesity, and obesity has a link with diabetes. And once diabetes starts, so it is there. There is strong family history because so if someone in a family has history of pancreatic cancer, then the other family members have higher chance of having pancreatic cancer compared to those who didn't have it at all. And again, age. Like I said, if there is a sudden onset of diabetes at age greater than 60 years, please, the pancreatic cancer should be ruled out. So yes, smoking, sedentary lifestyle, which causes obesity and the rest, family history, genetics, age, pancreatitis, that is infection on the pancreas can also lead to it. So those are risk that can be linked to pancreatic cancer.
Doctor, and we'll be right back. Viewers at home, let's go forward on Marble. Thank you. You heard it, enjoy cancer. When cancer happens, enjoy every day without putting yourself through unnecessary stress. I hope we are all learning from this. Doctor, are you still there? Dr. Emmanuel, Joy, over to you.
All right, thank you so much, doctor. But then I want to ask, what's the survival rate of this pancreatic cancer and how is it diagnosed? The truth is, once I hear cancer, to be honest, what I see is death sentence. That's just the truth. Once that word cancer, I'm looking at it's not yes, when it's early detected. Yes. So that's why I want to ask doctor, what is the survival rate of this cancer and how is it diagnosed?
So, thank you, Joy. Yes, you are right in a way, and in other way, not completely right, to say that cancer, so people look at it as death sentence. But like Olori said, the secret about cancer and indeed many other health conditions is early detection. That's why people should be conscious of their health. They shouldn't wait until most of the time what we see in the hospital are people who are brought in very late because they have done all sorts of things, gone all kinds of places, so that is why. So if detected early, there is hope. The patient can be taken care of, surgery can be done to take it out and all that. But when it is detected late, it is usually very deadly, like we said. You know why? It is deeply seated, it is deep in the body where it is seated. And when it is late, the whole system has already been compromised. So that is why we say it's deadly. So survival rate is poor in advanced cancer, pancreatic cancer. So but it's not a death sentence if it's detected early. And like other ones, generally, if cancer is detected early, there is hope because there are other therapies. Even talking about, I think we also asked about diagnosis. The diagnosis can be by doing a CT. Sometimes they do a CT abdomen. It's a scan. It can be diagnosed. There are also other immunological tests that are done to be able to. Suspicion is key. When it is suspected, patient a CT scan is done. Abdominal CT scan pancreatic cancer, and then the are done. In addition to the general test like the blood sugar test, which is usually high because of that diabetes, and other things through blood count and the other general tests that are done.
So I want to find out, just like most of the cancer, the chemotherapy, how does this work? How can surgery help a patient who has been detected to have pancreatic pancreatic cancer. And also, what's the difference between pancreatic cancer and pancreatitis? So you have three questions. How does the chemotherapy, how quickly does the chemotherapy work? Then the surgery, is there, you know, how does the surgery help to save the life of the patient after it's been detected? And what's the difference between pancreatic and pancreatitis?
Okay, so pancreatitis, which is what I think you are trying to say. Pancreatitis is an infection, inflammation of the pancreas. That means if there's an infection, if there's an infection in the pancreas, pancreatitis, you know, so that's infection. Although when it becomes chronic, it may eventually become a risk factor for pancreatic cancer. But there are two different things. Infection is treatable. If it is bacterial, it will be treated. If it is viral, you know, all the medications are given. However, pancreatic cancer is different. It is not as a result of organisms. Pancreatitis is germ attacking the pancreas. That's why it's called pancreatitis. It becomes inflamed. But pancreatic cancer is the cancer that affects the pancreas. So two different things. Surgery helps, like I said, when it's detected early. I mean, the life of the patient is reasonably saved when it is taken out, especially very early, no metastasis. Patients live their normal life. The only thing they miss is the benefits that come from the pancreas, which is the insulin and all the other digestive enzymes. Well, of course, insulin can be given externally and the pressure. So there is also chemotherapy, like you said, but more of what is called immunotherapy because of the way pancreas is. So it's rather called immunotherapy. Immunotherapy is also very helpful, and there are a lot of studies and researches around that pancreatic cancer. So there's even the one called targeted therapy. So it is targeted specifically at the cells of the pancreas, and it has been proven to be quite helpful. So surgery is the mainstay. Immunotherapy it can be done, and of course targeted therapy and a lot of other researches in terms of management of pancreatic cancer.
What's the age the limit we are looking at? Is there a specific age group that suffer from this, or we have a lower? Because sometimes when you talk about prostate cancer, you say I think from 40 or 50 men should watch out. But now we are talking about pancreatic cancer. What age limit are we looking at, or can younger children even come down with this type of cancer?
Pancreatic cancer is rare in younger people. However, it is not impossible. You know, especially because of the changes in diet and other genetic factors, people younger can have it. However, the age that will begin to have more concern is 60 years and above. From 60 years and above, and when the person manifests some of those symptoms we talked about, abdominal pain, radiating to the back, jaundice, yellowness of the eyes, loss of weight, loss of appetite, weakness, sudden onset of diabetes. So when the age is 60 and above, the high index of suspicion is there. So it's rare in younger people, but it's not totally ruled out.
Done a great job this morning, but before you go, I want to find out how sustainable is this area of pancreatitis, because we've been talking about pancreatic cancer, and to that common man outside there who are not learned to understand pancreatitis. Can you help us to give a very common name that will be easy for them to understand what it means?
Yeah, okay. Before I attempt that, yes, you mentioned it's always good to end this kind of program by making sure that the average person in the street gets something out of it. So I will think that we can tell them, someone will say, ah, this kind of cancer everywhere. What is there anything I can do so that I don't get it? Well, can I prevent it? I would like to also think that that is very important for average person. So what do we say? We say people to quit smoking, cessation of smoking. People who are smoking, people should not be living a sedentary lifestyle. That means some form of exercise is important. People should not be eating too much junk. Some of these and processed food, all those things have some preservatives and other things that are not chemicals, all those chemically modified foods. That's why you see younger people coming down with some of those kind of cancer. So we will tell them lifestyle is important. Check your family history. If somebody died of pancreatic cancer, then the person has a higher chances of getting it. So you begin to check early. So nothing wrong with doing routine tests. You see people go to do routine tests, scan and blood tests to check. And then, of course, if people should be able to control their sugar intake so that in case they have a predisposition to diabetes, it will be controlled. So those are some of the information I think that average person on the list can take, on the streets can take to help themselves. And again, on the name, I may not really know what we can tell them locally, but of course, people know about diabetes. So if there's a sign of too much, someone passing frequent urination and all that, it's important to visit a health facility and be properly examined.
Thank you so much, Doctor. But before we let you go, I was actually arguing with someone. What is the average time an adult can use the restroom at night, now putting into consideration without taking water before bedtime? Because I was arguing with someone, but said I said no, when you go to the restroom more than 3-4 times and you didn't drink water, check yourself, something is wrong. And I said I was going to ask the doctors that. So for an adult, what is the average time you could use the restroom during bedtime, even when you didn't take water?
Yes. So, yes, taking water is a factor and water. If you drink a lot of water before you go to bed, yes, you may be able to really go to convenience up to 3 drinks. But if you live your normal life, you eat normally, not averagely 2 times. Some people only once, some people twice. Middle of the night and sometimes early morning is okay. Once it begins to have up to 3-4 times, it should be checked. And of course, there are many things that can cause frequent urination beyond sugar issues. Urinary tract infection is there. Alcohol intake can make people to wake up to wee. For men, it can also be early signs of prostate enlargement. All those are topics for another day. But 2 times at night is considered okay. Once you get to 3 and above, without the person having taken a lot of water, then you should be able to get a eyebrow.
It's an honor to have you. I don't know whether you have a final word of advice to our viewers at home. If you don't have any, then we can just allow you to continue with your consultation.
Yeah, so the advice is for them to know that it's not a death sentence. This is an awareness that we are creating. I must commend you guys, Galaxy TV. You are doing very great to create awareness on health. So what you are doing is great. So the message out there is that pancreatic cancer is deadly because it is detected late, but it's not a death sentence because we call it silent killer because of late detection. So if we have awareness and people look out for it, that means we can mitigate. So the awareness is created. When you know somebody complaining of abdominal pain, that they treat ulcer, it doesn't go, back pain, frequent urination or diabetes at late age, loss of weight, yellow fever, yellowness of the eyes, which we call yellow warning sign for pancreatic cancer. So those things are things you can note and say, oh, Abego, I listened to a program and pancreatic cancer was discussed. Let us go and check. So once you do that, you will see that life can be saved. So with that, I want to thank you for this opportunity to educate the public.
Thank you. Thank you so much,
Doctor. To use you to care for the people out there, and you never run dry.
We are seeing the good works you're doing. We are seeing the lives you're saving. Thank you.
God bless you. More grace. Thank you, and have a beautiful day.